Welcome to Lux Scout Psychology. Imagine a stage brightly lit with a single figure demanding the spotlight. This is the world of histrionic personality disorder, or HPD, a mental health condition where life often feels like a performance played out for an audience. But behind the dramatic displays and the insatiable desire for approval lies a deeper, more complex story. Understanding HPD requires looking beyond the surface, past the theatrics, to the vulnerable individual yearning for connection and validation. This journey into the heart of HPD begins by unraveling the complexities of this often misunderstood disorder. At the heart of HPD lies an intense and pervasive need for attention. This need stems from a deeper place of insecurity and a fear of being invisible or insignificant. Individuals with HPD often struggle with low self-esteem and a fragile sense of self-worth. They crave external validation to feel loved and accepted, believing that their value lies in the eyes of others. This desperation for approval can manifest in dramatic pronouncements, exaggerated emotions, and a constant need to be the life of the party. While these behaviors might appear attention-seeking on the surface, they are often a cry for help, a way to fill the void of inner emptiness and insecurity. Imagine a life lived in a perpetual spotlight, where every interaction becomes a performance. This is the reality for individuals with HPD, who often feel an overwhelming compulsion to be the center of attention. They might dominate conversations, ensuring all eyes remain fixed on them. Their physical appearance often becomes another tool, a carefully constructed facade designed to draw the gaze of others. But this constant performance can be exhausting, both for the individual with HPD and those around them. The need for validation becomes a relentless pursuit, leaving them feeling empty and unfulfilled despite the attention they receive. Their relationships often suffer, as genuine connection is overshadowed by their need to be admired and adored. For individuals with HPD, seduction often becomes a powerful tool, a means of securing the attention and validation they desperately crave. Their charm can be intoxicating, their ability to make others feel special, almost effortless. This seductive behavior isn't necessarily about seeking sexual gratification. It's about wielding their allure as a means of control. However, this approach to relationships is often superficial and short-lived. Once the initial thrill of the chase subsides, individuals with HPD may quickly lose interest, driving them to seek new conquests. This pattern of fleeting connections can leave a trail of hurt and confusion in its wake. The emotional landscape of someone with HPD can be compared to a dazzling fireworks display. Brilliant, captivating, but ultimately fleeting. Their emotions are often expressed with dramatic flair, a whirlwind of intense feelings that erupt and dissipate just as quickly. They might swing from fits of laughter to tearful outbursts, their moods shifting rapidly in response to external cues. This emotional volatility can be both exhilarating and exhausting for those around them. Beneath the surface of these dramatic displays often lies a shallowness of emotion, making it challenging to form genuine connections. The question of what causes histrionic personality disorder is complex, with no single answer. It's not a matter of simply choosing to be dramatic or attention-seeking. Instead, it's a multifaceted interplay of genetic predispositions, early childhood experiences, and individual personality traits. Some individuals might have a genetic predisposition towards heightened emotional sensitivity or a greater need for external validation. These innate tendencies can then be amplified or mitigated by the environment they're raised in. Early childhood experiences, particularly the quality of parent-child relationships, play a crucial role in shaping personality development. When these needs aren't met, it can create a vulnerability to developing personality disorders like HPD. It's the complex interaction of these various elements that ultimately shapes an individual's personality and susceptibility to mental health conditions. Childhood experiences, particularly within the family system, can have a profound impact on the development of HPD. Imagine a young child desperate for their parents' attention, striving to please them, to earn their love and approval. If these needs are met inconsistently, it can create a pattern of seeking external validation to feel worthy. If a child is constantly told they're special or talented without any real achievements to back it up, they might develop an inflated sense of self-importance. This can lead to a fragile ego that requires constant admiration and affirmation from others to maintain its sense of value. These early experiences can create deep-seated beliefs about the need to perform for love and attention. Beyond environmental influences, certain innate personality traits and temperaments can increase the likelihood of developing histrionic personality disorder. Imagine individuals who are naturally more sensitive to rejection, who crave social approval and fear being ignored or forgotten. They might be naturally more expressive and dramatic in their communication style, often captivating those around them with their charisma and charm. While these traits aren't inherently negative, they can become problematic when combined with a history of early experiences that reinforce attention-seeking behaviors. A naturally outgoing and expressive child might learn to amplify their dramatic tendencies if they consistently receive positive reinforcement for such behavior. Understanding HPD requires looking beyond simplistic explanations and embracing the biopsychosocial model. This model acknowledges the intricate interplay of biological, psychological, and social factors in shaping mental health conditions. From a biological perspective, genetics might contribute to a predisposition towards emotional sensitivity or impulsivity. Psychologically, early childhood experiences, attachment styles, and learned coping mechanisms play a crucial role in shaping personality development. Socially, cultural norms and societal expectations can influence how individuals express emotions and seek attention. Therefore, treating HPD effectively requires addressing all aspects of this complex interplay. Diagnosing histrionic personality disorder involves a delicate dance between observation, empathy, and clinical expertise. Imagine a therapist trained to look beyond the surface, carefully observing their patient's demeanor, their words, their very presence in the room. The patient arrives, perhaps dressed in a striking outfit, their energy filling the space as they recount a recent event. Their story is captivating, full of emotional pronouncements and theatrical gestures, yet often lacking in concrete details. The therapist listens attentively, noting the patient's need to be the center of attention, their tendency to exaggerate emotions, and their attempts to charm and seduce. They observe how the patient's mood shifts rapidly, their laughter quickly turning to tears. The therapist's role is to approach the patient with compassion and understanding, creating a safe space for them to explore their thoughts, feelings, and behaviors without judgment. The diagnostic process for HPD often involves guiding patients on a journey of self-discovery. Imagine a therapist gently guiding their patient to reflect on their relationships, their work life, their interactions with the world around them. They might explore the patient's need for attention, asking them to consider what drives this need. They might delve into the patient's emotional volatility, helping them to identify triggers for their dramatic shifts in mood. The therapist might also explore the patient's tendency to perceive relationships as more intimate than they actually are. This process of self-reflection can be challenging, often bringing up painful memories or long-held beliefs about oneself. In the realm of mental health, where diagnoses often share overlapping symptoms, accurately identifying HPD requires careful consideration and a process of elimination. The therapist must differentiate HPD from other conditions that might share similar features, such as borderline personality disorder, narcissistic personality disorder, or even bipolar disorder. For instance, while both HPD and borderline personality disorder involve emotional intensity and a fear of abandonment, individuals with HPD tend to be more extroverted and attention-seeking. Similarly, while both HPD and narcissistic personality disorder involve a need for admiration, individuals with HPD primarily seek attention and validation. Distinguishing HPD from these other conditions is essential for developing an effective treatment plan tailored to the individual's specific needs and challenges. Diagnosing HPD is not a one-size-fits-all approach. It requires a comprehensive assessment that takes into account the individual's unique history, personality traits, and current life circumstances. The therapist might use structured interviews, standardized questionnaires, or even collateral information from family members or friends to gain a more complete understanding of the individual's experiences. They might explore the individual's medical history, ruling out any physical conditions that might be contributing to their symptoms. This thorough evaluation helps the therapist to determine the severity of the disorder and identify any co-occurring mental health conditions. This information is crucial for developing a personalized treatment plan that addresses the individual's unique needs and goals. For individuals with histrionic personality disorder, embarking on a therapeutic journey can be a transformative experience. Therapy provides the tools and support needed to tend to this garden, to clear away the weeds of insecurity and self-doubt, and cultivate a landscape of emotional well-being. It's a collaborative process, a partnership between therapist and patient, where trust, empathy, and a shared commitment to growth form the foundation for change. The first step often involves creating a safe and supportive space where the individual feels comfortable exploring their innermost thoughts and feelings without fear of judgment. From this foundation of trust, the therapist can then guide the individual in identifying the maladaptive thought patterns, emotional reactions, and behavioral patterns that contribute to their distress. Through this process of self-discovery, the individual gains a deeper understanding of the underlying motivations behind their actions and begins to develop healthier coping mechanisms. Cognitive behavioral therapy, or CBT, offers a structured and goal-oriented approach to treating HPD. Imagine a choreographer refining a dancer's movements for a harmonious performance. CBT therapists help identify negative thought patterns contributing to emotional distress. They challenge and reframe these thoughts, replacing them with balanced ones. CBT also modifies behaviors maintaining the cycle of HPD. Through role-playing and real-life experiments, individuals apply new skills in daily life. Section 3. Unveiling the subconscious. Delving into the depths with psychodynamic therapy. Psychodynamic therapy delves into the past, exploring early childhood experiences and unconscious conflicts. Imagine an archaeologist carefully excavating an ancient city, uncovering layers to understand its present-day ruins. Early relationships shape our sense of self. Techniques like free association and dream analysis help uncover unconscious patterns influencing present-day behaviors. Bringing these patterns into awareness helps develop healthier relationships. Section 4. The power of shared experiences. Finding support and growth in group therapy. Group therapy offers a unique setting for individuals with HPD to practice new skills, receive feedback, and challenge negative thought patterns. Imagine a circle of individuals sharing struggles, offering encouragement, and celebrating growth. It's a humbling and eye-opening experience for those used to being the center of attention. They learn they are not alone and witness the challenges and triumphs of others. Group therapy provides a safe space to practice assertiveness, set boundaries, and receive feedback. Individuals can experiment with new ways of interacting, receiving support from the therapist and peers. Embracing authenticity and growth. As the curtain falls on our exploration of histrionic personality disorder, remember, this is not the end. For those with HPD, healing and growth are ongoing, a journey of self-discovery. Theatrical tendencies and emotional fireworks are coping mechanisms for a vulnerable heart. Healing involves self-compassion, acceptance, and embracing authenticity. Therapy offers tools and a supportive space for this journey. It's about regulating emotions, communicating needs, and building genuine relationships. The journey is long but rewarding, leading to true self-acceptance and fulfillment. Section 2. A call for compassion. Understanding the heart of HPD. Understanding histrionic personality disorder requires more than just memorizing symptoms or diagnostic criteria. It demands empathy, compassion, and a willingness to see beyond the often misunderstood behaviors. Individuals with HPD are not simply attention seekers or drama queens. They are complex individuals struggling with deep-seated insecurities, a fear of invisibility, and a longing for connection. their theatrical displays, their emotional volatility, their need for reassurance. These are not manipulative tactics, but cries for help, expressions of a deep-seated fear of rejection and a desperate need to feel loved and valued. Just as we wouldn't judge someone with a physical illness for their symptoms, we must extend the same compassion and understanding to those living with mental health conditions like HPD. Instead of labeling or dismissing, let's strive to understand the underlying pain and vulnerability that drive these behaviors. Let's challenge the stigma surrounding mental illness, replacing judgment with empathy, and creating a society where individuals with HPD feel safe seeking help and support. By fostering a culture of compassion and understanding, we can empower individuals with HPD to embark on their healing journeys, to embrace their authentic selves, and to live full and meaningful lives. Please like the video and share it with others. Thank you for watching.